The ghetto tax or poverty premium refers to the predicament that lower-income individuals predominantly face. They bear higher expenses for everyday living due to their financial constraints. This not only encompasses financial costs, but also the costs in time, health, and lost opportunities. It also alludes to the indirect costs social circles and broader societies bear due to the existence of poverty. Ghetto tax isn't a literal tax, but a scenario where disadvantaged individuals pay more for similar goods or services due to their financial status or location. This has been broadly discussed in a paper by Brookings Institution named From Poverty Opportunity, putting the market to work for lower-income families. This challenge is intimately connected to mobility. Those owning a car can easily drive to areas with affordable goods and services. Those without this luxury face escalated local prices. Moreover, for lower-income earners, alternative financial services like check cashing, payday lenders, and pawn shops are more frequent but more pricey. Traditional banking does provide options like avoiding monthly fees and availing higher interest rates, but it poses other problems like expensive overdrafts in impoverished areas, a smaller number of atoms, that two third-party ones charge all users considerably. This creates what is known as a banking desert. Similarly, in the health sector, poorer people endure detrimental and costly health issues and fewer available health resources, a situation known as medical or pharmacy desert. These individuals usually have no or low-quality health insurance, resulting in insufficient preventive and routine health care. Environmental pollution damaging health is higher in minority communities. Reduced healthcare accessibility also propagates higher maternal and infant mortality rates alongside premature and underweight births. Subsequently, these conditions lead to psychological, social, political, and economic repercussions in the society and often result in various psychological and chronic medical conditions like adage. Diagnosis is another costly affair, such as the $1,470 fee charged by Neal Psychological Services in Illinois, USA for ADHD testing. Moreover, because mental health care is typically expensive, like the $60 to $90 per week for a subscription with BetterHelp, an online therapy service, many in impoverished communities lack access to it. Grocery access. Smaller dollar stores offering limited fresh food options heavily populate low-income neighborhoods, replacing full-fledged supermarkets with vast fresh food sections. This results in the elevation of fresh food prices, either due to extra transportation costs to distant grocery stores, or because such food in low-income areas bears a higher price tag due to challenges like lack of purchasing power, sales volume, and supply chain management issues for perishable food. Other potential sources of food in these areas, such as gas stations or convenience stores, often lack healthy options. Such regions, lacking access to fresh food, are commonly termed food deserts. Restrictions from landlords, homeowner associations, HOAs, and local authorities, as well as zoning laws, often prohibit community or private gardening, further limiting food access. This situation adversely affects impoverished communities as they struggle with grocery accessibility, high transportation costs, and crime. Price inflation in retail sector. Research indicates that both rich and poor pay roughly the same prices for identical goods. Yet inflation rates for basic, low-cost goods typically purchased by lower-income individuals can increase more rapidly compared to goods bought by the wealthier population. High interest rates are common in rent-to-own and consumer finance plans, which are more frequently utilized by those incapable of making upfront payments for their purchases. Lack of affordability for purchasing in bulk results in the poorer section missing out on volume discount. An example showing the convergence of higher retail and health costs is the prevalence of nicotine addiction among poorer classes, partly due to cigarette companies targeting these communities. Besides health-related costs, individual cigarette purchases or smaller packs cost more per unit compared to larger cartons, increasing the overall expenditure. Illegal single cigarette purchases, although tax-free, may lead to costly legal repercussions. Utility access and costs. For those with inadequate credit or previously missed utility payments, service providers may apply hefty deposits or connection fees. Prepaid electricity services, often utilized by low-income consumers, can bear a higher rate compared to contracted utilities. The lack of electricity due to depleted prepaid service can lead to several problems like spoiled food, lack of utilities such as internet, light, and heat, thereby limiting access to economic opportunities. Furthermore, The poor are often subject to paying higher charges for long-distance phone calls. The accessibility of government services. When interactions with government services become complex and recurrent, coupled with stringent requirements and preconditions, the outcome tends to be fewer people utilizing these services. Furthermore, impoverished individuals with limited resources often face exclusion. This was evidenced in Florida as an increase in the complexity of unemployment claims processing aimed at reducing claims. This isn't a phenomenon isolated to Florida. Inefficiencies mar the broader U.S. unemployment system. People living in plush neighborhoods with high-end homes tend to benefit more from FEMA disaster aid compared to individuals in impoverished sections due to the challenging application process. A similar bias is seen in FEMA home buyout. Some aid schemes are skewed towards communities capable of co-funding the aid costs. The Army Corps of Engineers further demonstrates this partiality by favoring the protection of opulent homes with flood control systems in their cost. Benefit analysis. Small business loans. Efforts towards availing resources to underprivileged neighborhoods often hit a snag due to banks' hesitation to lend businesses in low-income areas. Additionally, businesses in these areas face the barrier of higher loan terms and more expensive business insurance. Insurance difficulties. The less well-off often cannot afford insurance coverage, making them more susceptible to financial losses after adversarial events. Employment inequality. A disparity in the minimum wage rates across states and localities results in low-income earners, who are mainly wage workers with fewer benefits compared to salaried counterparts. The contracted or subcontracted workforce faces even greater deprivation in terms of benefits and protection. Lack of health insurance for these workers translates to hefty medical debts, while the absence of parental leave might cost them their jobs when they start families. Neglecting retirement benefits can force workers to extend their working years, and not providing paid time off and sick days can exacerbate stress and negatively affect the health of employees and their colleagues, especially for infectious diseases. Further, the U.S. unemployment system does not cover non-employee workers like janitors, drivers, food service workers, slaughterhouse personnel, among others, who often work on a contracted or subcontracted basis. Education deficiency. Insufficiently resourced schools often produce poorer education outcomes, which can lower the lifetime earnings of the students. Besides this, schools in low-income areas often lack essential personnel like nurses and counselors and modern technology. Environmental justice. Low-income and minority neighborhoods often become the dumping grounds for environmental threats or general property value hazards, to the detriment of the health of its residents and the value of their homes. These threats range from landfills, power and chemical plants, oil wells and pipelines, industrial parks and sewage treatment plants, to fracking sites, incinerators, quarries, prisons, adult entertainment clubs, and transport hubs like railways, highways, airports, and seaports. The justice system often discriminates against vulnerable populations, predominantly the poor. These individuals are at a higher risk of facing penalties or imprisonment for comparable offenses committed by the rich. They may even be erroneously convicted frequently. Lower-income societies experience harsher police interventions than affluent areas. The court system can impose financial sentences and costs, leading to legal debts, detention, and the withdrawal of driving privileges for those unable to pay. A demanded cash bail, insisting a refundable cash down payment for the accused to be freed before the trial, places another incapacitating burden on them. Failure to punctually appear in court results in no reimbursement. The impoverished, if unable to settle the full bail amount, might resort to securing a bail bond. They would pay a non-refundable fraction of the bail amount and give a security, which could be valuable assets, to the bond issuer in exchange for the full bail amount paid to the court. The bond issuer can contract a bounty hunter if the debtor fails to appear in court. Additional high charges in prison for essential services such as phone calls and emails can compound their struggle. Poorer areas typically have more affordable housing but higher crime rates, making their residents more susceptible to expensive crime recoveries. Implementing crime deterrent measures such as security systems could imply added expenses. Poverty, above the human suffering it causes, also burdens the wider society through various externalities. For instance, big corporations like Walmart and McDonald's employ a significant number of beneficiaries from federal aid programs like SNAP and Medicaid. The government effectively bears the cost of supporting these employees while the corporations benefit from their labor. Moreover, the poor, grappling with pressing needs seldom save for retirement or emergencies. This leads to financial distress, lower life expectancy, and the loss of social and cultural assets as per the Poor People's Campaign. Around 250,000 people in the U.S. die annually due to poverty. The estimated annual loss to poverty and its related effects, including education, healthcare, crime, and homelessness, amounts to approximately $14.42 trillion. In addition, the poverty industry, which profits from the financial vulnerability of the poor, makes a yearly revenue of $33 billion in the U.S. Hidden costs, arduous to quantify and predict, add to the financial burden imposed on the poor. Emergencies or unexpected expenses often leave impoverished people unable to afford basic necessities. Industry costs due to socioeconomic inequalities are substantial as well. For instance, the U.S. healthcare industry incurs losses due to medical tourism since domestic healthcare costs far exceed international medical travel expenses. Further, black market systems lead to loss of business, tax revenue, and pose potential dangers due to unregulated products on both the consumers and the public.